Good morning. I'm Yvonne Williams, President of the Greater Macon Chamber of Commerce. It's my distinct honor to welcome you and some distinguished guests from our healthcare community, including Coliseum Health and Navicent Health, to our Friday Town Hall virtual meeting. This is a program that we offer weekly to our chamber members and the community at large as part of our effort to inform and engage during the COVID epidemic. Now more than ever, we are preparing to celebrate National Hospital Week on May 10th through 16th. We are thrilled to have this advanced opportunity to thank all of our healthcare workers, the first responders, and our community executives in healthcare who are working every day to keep our community safe. It's a week of thanks, a week that we've enjoyed all along this week with events to celebrate our appreciation and show outpouring outreach to these people who are working on our behalf every day. Today's healthcare forum is sponsored by Macon Occupational Health. It's a wonderful chamber member and an ongoing supporter of the healthcare community here in Macon Viv. We have joining us Jonathan Pitts, Vice President of Clients Relations, who will offer some remarks. Thank you, Jonathan, for being with us.
Hey, thank you, Yvonne. On behalf of Leonard Bevel and the team at Macon Occupational Medicine, we want to thank you for giving us this opportunity to serve as your presenting sponsor. We feel like this is a great opportunity to share some information about healthcare, and this is a great venue with the Zooms and the town halls to keep our chamber members informed of what's going on. And here at Macon Occupational Medicine, part of our vision is to be the occupational health provider for all of Central as well as the whole state of Georgia. We offer first-class, high-quality healthcare. And behind me, I have some information about some of the services that we offer. And to kind of go right here, getting started with our physical exams. Right now, we want to make sure that when you send an employer, you're hiring someone, you make sure you have somebody that doesn't have any issues. And if you do have issues, we want to make sure that we can address them and make sure that person is ready to go to work and can do a great job for you. Another thing that we have here is our drug screen and breath alcohol program. We want to make sure that when you hire someone, they're drug-free. And we hope that you're going to take advantage of the drug-free workplace policy or programs that's out there that can help save you money for your business to continue to grow and advance. Part of these services right here that are listed can also be brought to you at your place of business. So not only are we offering services here, we will bring some of those services to you as well. On the other flyer, we have our list of our board certified physicians and other services that we offer when it comes to a workplace injury. We don't want anyone to get hurt, but if somebody does get hurt, we want to make sure that Macon Occupational Medicine is your first choice for occupational health services, as well as our rehab services. Part of our philosophy here is an industrial athlete approach. We're trying to do our best to get your person back to work as quick as possible. So it's a one-stop shop for all of your occupational health service needs. At the bottom, we offer safety programs. Right now, respiratory programs is expanding. We get questions all over the place about respiratory programs as well as doing respirator fit tests. So that's another service that we offer to continue to meet that need for our clients in Middle Georgia and throughout the state of Georgia. And also part of our philosophy is to win the day. And as I end this mission, we want to make sure that we encourage everyone to win the day and have a fantastic Friday. And with that said, Yvonne, I want to turn it back over to you.
Thank you, Jonathan, and for Macon Occupational Medicine for these wonderful opportunities to engage with the healthcare community. I'm very fortunate to welcome now our Greater Macon Chamber Chair, Julia Magda, who will introduce our distinguished guests from Coliseum Health System and Navicent Health System.
Thank you. The first person I'd like to introduce is Stephen J. Daugherty, better known to us as Steve. He's the Chief Executive Officer of Coliseum Health System in Macon, Georgia. Originally from Oklahoma, Steve has worked with HCA Healthcare for 30 years and has over 18 years of administrative experience, the last 5 being here in our town. Previously, he has served as an acquisition specialist for the HCA West Florida Division, CEO at Northside Hospital in St. Petersburg, Florida, CEO at South Bay Hospital, COO at St. Lucie Medical Center, and Vice President Administrator at Gulf Coast Hospital. Steve received his MBA from Florida Gulf Coast University and has a bachelor's in biology from Augustana College in Sioux Falls. He also has a diploma in medical technology recognized by the American Society of Clinical Pathologists. Steve serves on several boards in Macon, including the United Way of Central Georgia, the Otis Redding Foundation, and you'll see a poster behind him, and the Middle Georgia State University Foundation. The Chamber is pleased to welcome Steve Daugherty, who will give an update on Coliseum's response to COVID-19.
Thank you, Julia, and thank you to the Chamber. First, I want to say thank you to Dr. Tom Oliver. From the very beginning of this pandemic hitting our community, we reached out to each other, and we've been sharing information not only across our two health systems, but also with Houston Healthcare as well. And that's really hopefully to eliminate confusion that we for decision we might make for the medical staff and the community at large. So thank you, Tom, and to Navicent Health System for being such a good partner through this pandemic. You know, as we entered this pandemic here in Macon, our health system and our company set some guiding principles, and the first of those was to be there for our patients. Certainly a scary time, and we knew that we were going to have patients impacted by this, so that was our first guiding principle. The second was partner with others, not only with other health systems, but other vendor partners as well that we were going to need to support us through the pandemic. Third, be a resource for the community and the government, and we've regularly communicated what's happening in our health system with the Chamber, with the mayor and the county commission, as well as the state government as well. And then our fourth was to accelerate through the crisis. So one, to get better, and getting better at especially infection prevention as we work through this, learn more and faster. And certainly we've pivoted many times through this initial phase of this pandemic, and then strengthen our culture. This is a scary time even for people in healthcare and that are used to taking care of very sick people, but making sure that we keep our staff focused on our mission. The care and commitment to human life has been extremely important. And then to improve our health system so that hopefully that with getting better and learning faster and strengthening our culture, we come out into the recovery phase of this a better organization so that we can serve the community of Middle Georgia. So just a couple of quick statistics across our health system. Since the 1st of March, we have tested 656 symptomatic patients. Of those, about 130 have tested positive. And so that's about an 80% negative rate. So I want to put a little positive in here about this, is that 80% of the patients that came in with symptoms that could have been COVID-19 tested negative. And of those 130 patients, those patients came from 39 different counties across Middle Georgia. So Macon continues to be a hub for healthcare, and we continue to serve not only the immediate Macon-Bibb community, but many communities outside where there are either no healthcare facilities or critical access that can't handle the severity that this illness brings. So that's a quick update from Coliseum Medical Centers.
Okay, Steve, thanks for sharing your insight with our community and for being an inspiring leader during this challenging time. Our next distinguished guest is Dr. Tom Oliver, who currently serves as the President of Hospitals and Clinics for Navicent Health. Prior to taking that role, Dr. Oliver served as the Chief Clinical Officer and Chief Operating Officer for Navicent Health Enterprise Clinical Systems and enjoyed a distinguished career as a radiologist for Radiology Associates of Macon, which started in 1998. Dr. Oliver, thanks for joining us today. We look forward to your remarks about your COVID-19 update with our audience now.
Tom, you're on mute.
Dr. Oliver?
I think you muted me. Can you hear me now?
We can.
Okay.
Thank you.
I would like to say good morning, everyone, initially, and I would like to thank the Greater Macon Chamber of Commerce and Macon Occupational Medicine for hosting this event to disseminate information about this pandemic to the community. I would also like to acknowledge my administrative colleagues, Steve Daughtry and Greg Cables from the Coliseum Systems. And I appreciate Steve's opening remark. And Steve and I actually gave a broadcast to all of our employees by Facebook over a month ago. And Steve so aptly at that time said that at this time, fighting this crisis in the community, that we are not competitors, we are collaborators. And I appreciated that remark by Steve at that time, and that is true. And we have been in virtual daily contact to see what we could do together as a hospital system throughout Central Georgia, along with Houston Healthcare, for the betterment of the community. As a physician, I would like to just make a few opening general remarks about the pandemic, and then let you know what Navicent Health has done to respond to this crisis. First of all, what is COVID-19, or SARS-CoV-2 as it's been called sometimes? COVID-19 stands for Coronavirus Disease 2019. It's called a novel virus sometimes. That means that this particular virus has never infected the human population before, so it's new or novel. And it was discovered in 2019 in China initially. And SARS stands for Severe Acute Respiratory Syndrome, because the predominant symptoms of this disease are respiratory. So what can you do to help you and your family stay healthy during this pandemic? Everyone has heard about social distancing, but this is so important. It is important to stay 6 to 10 feet away from other individuals when you're out in public. This particular disease is spread by droplets. So when people sneeze or cough, or even talk sometimes, if they're infected, a little micro droplets can come out. And if they get in your mucous membranes, if you inhale them and they get in your mouth or your eyes or your nose, then you can become infected. It's important to wear a mask in public. That helps not only protect you, but protect others as well if you should be infected. Wash your hands frequently with soap and water. And you have to wash your hands for at least 20 seconds in order to kill the coronavirus. Try not to touch your face with unwashed hands, because the coronavirus can live for a day or two on certain surfaces. So if you were to touch those surfaces and then touch your face, you could infect yourself. And also, very importantly, if you are sick and have symptoms, seek medical care, but also stay at home and quarantine yourself to keep other people from becoming infected. So who gets sick with this? Anyone can contract the coronavirus, but about 50%, we don't know the exact number yet, but about 50% of people that become infected are either completely asymptomatic, have no symptoms at all, don't know they're infected, or have such minor symptoms that they're not aware that they may have the coronavirus. About 20% of people that become infected get sick enough to where they have to seek hospital care. And around 5% or less of people have such severe symptoms that they need care in one of our ICUs, even ventilatory care. And unfortunately, this does have a reasonably high mortality rate, as we've seen over 250,000 people worldwide, unfortunately, die from this disease. And the ones that are most affected are the elderly and those with what we call comorbidities, people that have other conditions like diabetes or cancer or weakened immune systems. So about 80% of people who have died so far are over the age of 65. So we need to particularly protect that vulnerable part of our population. So how does this compare to the flu? I've heard comparisons with that. So epidemiologists, or scientists who study how diseases are spread and disease patterns, have a term they call R-naught. And R-naught means if for every person that's infected with a disease, how many other people will they infect in turn? Take a very contagious disease like measles. Measles has an R-naught of 30. So for every person infected, they will in turn infect 30 other people with the measles. The R-naught for the flu is 1 to 2. So relatively low. You will infect, or the average person will infect 1 to 2 people. Coronavirus, as best we know right now, COVID-19 is a R-naught of 2 to 3. So it's a little more infectious than is the average flu. It's also, unfortunately, more deadly. The flu worldwide kills about 0.1. or 1 out of 1,000 people that become infected worldwide, about 300,000 to 600,000 annually. So far, we don't know for certain, but initial indications are that COVID-19 has a mortality rate of 1 to 5%. It's closer right now to 5%, but as we test more people, we might see it drop into the lower percentile category. The symptoms: cough, fever, sore throat, shortness of breath if you get severe disease, even headache and abdominal pain or diarrhea. So several months ago, when we first saw this infecting our community, the hospitals came together, as Steve said, and we've operated in a concerted fashion regarding this pandemic. For the safety of our patients and visitors and teammates at Navicent Health, we have instituted the following processes. We have stood up a command center, and we are ready to respond in consultation with our physicians, independent and employed physicians, and our other teammates in our system to expand our capacity to accept patients and expand our ICU capacity should the need arise. We suspended non-essential services, as did the other hospital systems in town, to reduce the risk of exposure to our employees and the patients coming. So elective surgery and cardiac catheterization and so forth was delayed. And we also wanted to conserve our PPE, our personal protective equipment, which is so vital to our healthcare workers on the front line. We significantly limited visitation, being mindful of the needs of our pediatric population and our sicker patients in the ICU. We also did this in concert with the other systems. We instituted universal masking for everyone in the hospital: physicians, employees, patients, everyone. We had a screening protocol where everyone was screened at certain points when they came to the hospital to make sure they didn't have a fever or exhibit signs and symptoms of the coronavirus. Since February, we have stood up an incident command team to help identify issues and concerns about the COVID crisis and develop processes to help best respond to this pandemic. I would like to stress that our overriding and primary concern throughout this crisis has been and will continue to be the safety and welfare of our patients, our teammates, and the community. Thank you for this opening statement.
Okay. Thank you for joining us today, Dr. Oliver. We appreciate your leadership and your dedication to the safety and well-being of the Middle Georgia community. Our final guest is Greg Caples, the Chief Executive Officer of Coliseum Northside Hospital here in Macon and a certified fellow of the American College of Healthcare Executives. Prior to joining Coliseum Northside in September 2017, he served as the Chief Operating Officer at Grand Strand Health in Myrtle Beach, South Carolina. Greg began his 29-year career with HCA as a controller and then CFO before moving on to become COO at Emory's Johns Creek Hospital in Johns Creek, Georgia, and later TriStar Summit Medical Center in Hermitage, Tennessee. He holds a bachelor's degree in accounting from the University of West Florida in Pensacola. He received his Master of Business Administration from the University of Georgia, and he is a fellow, as I mentioned, of the American College of Healthcare Executives. He also has served as president of the Middle Tennessee ACHE chapter in 2014. Greg serves on the executive committee of the Greater Macon Chamber of Commerce Board, so it's my pleasure to introduce him today.
Thank you, Julia. And I want to also thank Yvonne and the Greater Macon Chamber of Commerce for hosting this event. It's great for us to be able to share some of the things that we've been doing and the important factors of this response to the pandemic. So I know Steve went over some of our guiding principles a little bit earlier and spoke to some of the things that have guided us through this, this pandemic and our response and how we've responded to the various aspects of it. And I want to talk a little bit further about some of those areas. So as our community is beginning to make decisions now about where they're going to go and what they're going to do, as our society starts to reopen and we're beginning to get back to a more normal activity level, there's a lot of decisions that have to be made. So our focus for the benefit of everyone on our campuses has been for creating both physical and psychological safety. So that term psychological safety is something that we might not be used to, but it's a reference to the peace of mind and feeling of safety that comes from a knowledge of the precautions that are being taken and the visual cues of a safe environment. So these precautions generally fall into 4 different categories for us as we've gone through this crisis: infection prevention, access to our facilities, distancing, and patient flow. And without going into the details of each of those plans and actions that have been taken, each of these 4 areas have been addressed in various ways to provide for the physical and the psychological safety of all that come to our campuses. I'd like to reference also one of the guiding principles that Steve mentioned, that as far as how we need to work with and continue to partner with others in our community, and also to be a resource for our community. And one way to highlight that is the way that we've worked with our EMS first responders. So the first responders have also needed to adjust to the issues that have been brought about by this pandemic. A key to the care and precautions that they give is communication. Communication is key. So call responses that come to them for patients with symptoms that could be COVID related are communicated to their crews to take precautions of donning the proper PPE and taking their other precautions. And those crews in turn communicate to our ER teams that they're transporting a person under investigation, so that then we can prepare the room and the egress to the room, as well as meet the crew outside to prepare to take the patient in. Our partnership with our community first responders in providing care in a new way has been very efficient and safe for all. And this is really just one example of how we've worked with others to try to make a safer environment for everyone that needs medical care at this time. So I want to thank you, Julia, for the opportunity to be able to discuss some of these things with you.
Greg, thank you for mentioning our first responders and being there for our healthcare community. We are equally grateful to you for your leadership and for your service on our executive committee for the Chamber. I'm now going to turn everything over to Yvonne for closing remarks and to bring in some questions from our community. Thank you all.
Thank you, Julia. Well, we certainly have appreciated these thoughtful comments and wonderful updates. We are well served in Greater Macon by a very robust healthcare industry. And so as we conclude the activity of this meeting, I'd like to pose a question to each of you that will help us set our sights for the future as we go forward to build upon this wonderful platform of healthcare. How has the COVID-19 pandemic experience changed the way our healthcare community should plan to evolve and operate? And what can we do to unite efforts that can help us move forward? I'd like to have that started out with Steve, if you will help with your answer to that question.
Well, thank you, Ivana. You know, I think we've all heard the term new normal across many platforms, and that's really where we are. The virus is still with us. It has not gone away. We don't know when we'll have a vaccine or a very effective therapy for it, although there are some emerging now. So I think you can expect to see some of the things that we have put in place at our hospital and other hospitals that will not go away. Restricted access points so that we can continue to screen people coming in and out of the hospitals. When you come into the hospital, you're going to see visual cues that tell you you need to socially distance. That's something that we're not accustomed to, and it continues to be a learning for the community. And then in our hospitals, you'll also hear verbal cues. So one of the things that we want to make sure people understand is that they should not delay care. Our hospitals are safe. We have protective measures in place. Our staff have appropriate PPE. We have the equipment to take care of people that are sick, but we're also cohorting those COVID patients into separate parts of the hospital so that people that have other issues can come here and feel that they're safe. So when you come now into Coliseum Health System, you will hear overhead announcements on the hour, reminding not only patients to socially distance and to wash their hands and to keep their mask covering their nose and mouth, but also those are cues for our hospital employees to periodically wipe down telephones, clean surfaces. So we're going to need to continue visual and audible cues to the public to reassure them that hospitals are still a safe place. They are still someplace that when you're sick, you should seek care. And we're prepared to do that in a very safe way.
Thank you. Dr. Oliver, we'd like for your response.
Yes, I think all of us need to remember in healthcare and the community that that this pandemic is a marathon and it's not a sprint. This virus is going to be with us for a considerable length of time. We don't know how long. It may be with us forever, like the flu. I think we're going to have to wait for a vaccine, and even the most optimistic estimates going through the clinical trials and then producing enough vaccine to inoculate the population. We're looking at probably early next year, mid next year. And we don't always find a vaccine, unfortunately, to every virus. We've been trying for 30 years to develop a vaccine for HIV. We have vaccines for hepatitis A and B, but we can't get a vaccine to work for hepatitis C. So, and as Steve alluded to, there are some promising medications or drugs. Remdesivir, which was used for Ebola, may have some benefit, but it's not a cure. So we have to continue the social distancing. And as Steve said, our hospitals are a safe place to come. We are beginning re-entry phase, which means we have started doing elective surgery cases, mammography and so forth, and where safety is of the utmost concern to us in that regard. This pandemic has had a significant impact on our community, our healthcare system, our state, our nation, and the world. I don't think we'll ever be quite the same, but I think we can come out of this stronger with lessons learned. It will help us prepare for the next crisis, whether it be next year or a decade from now. And I am an optimistic person by nature, and I think there's always a silver lining in every cloud. And I think we found a few silver linings and bright spots throughout this pandemic. One is we've seen across the country a significant reduction in hospital-acquired infections, MRSA and C. diff and so forth. I won't go into the details of them. But these are infections that people can acquire in the hospital. And through rigorous hand washing and hand hygiene and so forth, we have seen a significant reduction, about a 50% reduction in hospitals across the country in these infections. So that's certainly a positive. And we have seen the community come together to help the healthcare workers and the community in general in ways that we have not seen before. And the hospitals have worked collaboratively together for the good of the community, as has been mentioned by both Steve and myself. We have found new and unique partnerships in the community. Nonprofit Angel Flight Soars out of Atlanta has helped us transport by airplane some of our test specimens to Charlotte to expedite the results so that we'll know whether patients test positive or not. Feed the Fight campaign, which has helped local restaurants stay viable during this crisis. GEMA, the Georgia Emergency Association, Management Association, Agency, excuse me, and Macon Bib have helped us stand up a temporary medical unit on the Navicent Medical Center campus, 24 beds, just in the eventuality that we would need additional capacity sometime in the next couple of months. We have had numerous meal donations from restaurants and community sources in Central Georgia to help feed our frontline personnel, which is very much appreciated. And we have seen parades and numerous words and acts of kindness and encouragement and appreciation of our healthcare workers. And I can't tell you how much that means to the nurses, respiratory therapists, and others that are taking care of the sick. So I think we are going to come out of this stronger as a healthcare system. We're going to have learned a lot of lessons, and we can put those to use in the future. And I want to reiterate again what Steve said: our hospitals are a safe place to come. So if you need treatment, which has been delayed, we are this month opening up our systems for those that need care. Thank you again.
Perfect. Thank you. Now, Greg, we'd like your response.
Thank you, Yvonne. So I'm of the same opinion as both Steve and Tom, that this new way of looking at things is something that will probably be with us for a while. And so as a part of the things that I've learned through this crisis is that we've had to accelerate our learning, and we've had to do things and respond and pivot to things that have happened in a much faster way and to understand what's going on. And so one of the areas that I think has been really key for us in the response has been just to accelerate our learning related to empathy towards the patient's view of the world. They're now seeing, all patients, employees, and everyone is seeing the world through a different lens than we did before. Fortunately, as we were heading into this, we, for several months, had already been training our staff on something that we call compassionate connected care, which is really all about looking at our patients with an empathetic eye. So some of the changes during the pandemic response have highlighted new considerations for us. For example, significant visitor limitations have been in place, which is a situation that has often brought with it a higher level of anxiety. But I've been gratified to hear about how our staff have responded to this new situation of patients being without their loved ones when they need them. One of our earliest COVID positive patients that we had thought enough to call me after her discharge and to let me know that when she was admitted, she was really scared and feeling incredibly isolated because she was transferred in from a few hours away, and then also could not have any family members allowed to be with her because she was COVID positive. She told me how much it meant to her that when having that feeling that our staff treated her as if she was their family, often referring to her as their family. It made her hospitalization bearable, and so that she was able to heal. So I think that we have learned a lot, and we'll continue to learn a lot. And these things will stay with us for a while as we do our best as a community to provide the best healthcare that we can. Fortunately, the good news is we've been able to recently modify some of our visitation policies to allow for some increased visitation. And I think that will be a positive thing for everyone. But in conclusion, I did want to say that we believe that our experiences have helped us and will continue to help us to become a stronger organization after the crisis than we were before it started. Thank you, Yvonne.
Thank you. Well, gentlemen, we certainly appreciate your valuable time today, especially with your mission critical work ahead of you, as you have every day. But we're so proud of the great presence we have from our medical community here in Macon-Bibb. And I also want to thank Macon Occupational Medicine for presenting today on a very, very timely topic. If you're a chamber member or a business leader in this community, this is a valuable program that you can offer to your employees. This will be posted on our website. I would recommend that you share this with your vendors, your customers, so that we can all be working together to provide a safe Macon. And we also want to leave today with a very strong hands up to our medical first responders. We so appreciate you. This has been a week that we really want to share our thanks, but that won't stop with this week. We will be thanking you more and more as we come out of this with a greater respect for our healthcare, our building of the healthcare community, and also us united together, because we are greater together. Have a great day. Thank you.
Thank you all.
Thank you.
Thank you so much.
Thank you.